So as I was preparing for this talk, I was also preparing for a meeting in DC. And the meeting was to figure out how are we going to measure positive health, protective factors for families, and social and emotional development. Because at this stage of what we know about health and all of the new sciences, these are really important topics now and are a matter of public policy for many. And I think that the science that we have on board, our own lived experience, which is probably the deepest science we can have on our own being, and the policy environment that we're in really is a perfect storm to recognize that ours is a social brain and that knowledge about brain plasticity and emerging knowledge about epigenetics and the role of emotions in that and the social determinants of health really make relationships, self-awareness, and mindfulness a matter of public health. My colleagues and I work together on really laying out what are the premises for this We Are the Medicine platform. It's a brain-smart approach to improving population health and healthcare reform. So it emphasizes the cross-cutting role of safe, stable, nurturing relationships to healthy child brain development and health across life. It legitimizes the known impact of embedded chronic stress on child development and well-being and adult health. And then I would say also the known impact of positive experiences that also are embedded, like the one I shared with you earlier. It calls out the syndemic of adverse childhood experiences and the possibilities arising from our new sciences of thriving, what I call our new sciences of thriving, to promote self-led, individual, family, and community, and organizational healing as well. Recognizes that child development depends on adult development and the urgency to begin now to address our own well-being, our own trauma, our own resilience, our own positive health as adults, working with and putting together systems and caring for children and youth, and concludes that the health of children in our nation calls us to squarely address trauma and promote positive health. And when we recognize, again, the foundational role of safe, stable, nurturing relationships and the possibility of neurorepair from what happens when those relationships are not in place, we really cannot escape the fact that full engagement of the individual and their own brains and hearts is essential to the healing process and to this pathway. And that's where mind-body methods come into place. And the science is revealing more than mechanisms. There are hypothetical mechanisms, obviously the link between those experiences and self-care behaviors and so on and so forth, but there's a lot more coming out now to not only explain the mechanisms by which this might occur, but also why there's so much variation. Why is it that many people have these experiences and do not have any of these problems? So the National Survey of Children's Health, we have a paper in December 2014 that explains more about what the findings, but the bottom line is that about half of US children have one or more, about 23% two or more, and the variation across states using a similar mechanism of measurement is wide, and there's a lot of variation in here that we're using to understand. Once you have 4 or more ACEs, the relative impact across income groups really starts to dissolve. So it is more likely that you have adverse childhood experiences when you're in lower income homes. That's true. And I think maybe most of you would assume that. However, once you have 4 or more ACEs, the probability that you have a child with an emotional, mental, or behavioral problem is exactly the same. But about only 1/3 of children in the US are both exhibiting this basic aspect of resilience and are free from ACEs. So 2/3 have ACEs or are not resilient. And it turns out that the resilience is the big story. Because if you have children who have 2 or more ACEs and are not resilient, they are 11 times more likely to have an emotional, mental, or behavioral problem than those who are both resilient and have no ACEs. However, if you look at children with 2 or more ACEs who are resilient, who have this very basic aspect of resilience we can measure, their odds are only 2.77. Now, those aren't great odds, but they're a lot less than 11. So to me, that tells me that resilience trumps ACEs, and that's really exciting. Confirming what we know, resilience is higher for children with 4 or more ACEs when stronger relationships exist. Mindfulness actually gives you the capacity to start to see the pattern that might be operating, good ones and not so good ones. And so the power of the pattern is very key, and you cannot rewire your brain unless you see the pattern that you're trying to rewire in the moment that it's happening or the moment that you're recalling it. These are the kinds of functions that improve body regulation, attuned communication, emotional balance, fear extinction, flexibility, insight, and so on. And there's a lot happening in the brain and in the body that really starts to impact these toxic stress pathways And so I ask, is it an audacious or timely idea to really go for it now in terms of mind-body neuroscience and population health, and making personalized medicine actually personal? And then I also think it's time to update our public health campaigns. This is the first thing I saw when I got off the airplane when I came to Johns Hopkins on July 2nd, 2014. And I took a picture of it. And I was like, it seems to me that we should put something else in there. So to me, it is a cross-cutting public health issue. And we can frame it in whatever way we want to. I'm going to just end by saying that, to make the paradigm link, these are my 6 wishes. When I go back to the past of public health and some of the milestones that took place since I was that little girl on the grass, we see this beginning of John Bowlby, Attachment and Loss, Neurons in Neighborhoods, finally published in 2000 by the IOM. 2010, the World Health Organization does their own ACEs study, finding in 21 countries the same patterns as what happened in the CDC. Now we have an exponential uptake of assessing ACEs and trauma-informed care. What I'm trying to do is install a core memory, a We Are the Medicine core memory into our collective consciousness, because I don't have one right now, but I'd hate us to lose the history and the possibility and not see the pattern that can help us understand that history is not destiny. We're not doing it well, so it's some of it's how you do it. So it's really the financing mechanisms from the top down. But I also think that if let's take the teacher, is somehow only rewarded for certain kinds of outcomes that don't involve his capacity in these areas, that we really shouldn't be expecting to see very much. And it really emphasizes why, the emphasis for my work, and I think many others, and I know Dr. Blum is really interested in this, and Claudia in the audience, in really engaging people, us, in our own experiences so that we're aware that we're not doing something to somebody. If you want to help that parent, you have to engage that parent in her own self-reflection. I would just say at the Healing Trauma in Baltimore session that we had, one of the statements, really is it's not what's wrong with you, it's what happened to you, and normalizing that of we are a living being that's evolving all the time, and we were affected by our past, and how to shift it so that the shame really is the key thing that holds in place a lot of these dysfunctional body responses. And so shame is very key, and Vincent Folletti, the PI for the CDC study, basically says that what you do by screening is you normalize this and you very casually give the person a sense of self-compassion. We're wired to look for what is dangerous so that we can keep ourselves safe and alive. And this is a hard wiring, and there is a way to grow the parts of the brain that do the opposite, but not without intention. It's like learning a new habit.
Join us for our next Dean's Lecture, where we celebrate the appointment or promotion of a faculty member to the level of professor at the Bloomberg School of Public Health.